Welcome back this week to our episode on the Delivered podcast, where we feature Dr. Patricia Petralba from the Thrive Life Center out in Tucson, Arizona. Welcome, Dr. Petralba.
Hi, Athena. I'm excited to be here and talk all the goodness about postpartum.
Yes, I'm so glad that you were agreeable to do this interview. Thank you.
Yes,
All right. So, just to start, Dr. Petralba, for our listeners, can you give just a little bit of your medical background and then a little bit of information on the Thrive Life Center?
absolutely. So, I'm an integrative medical doctor, and integrative medicine means it's essentially the best of both worlds. We combine Eastern and Western medicine, so
Mm,
traditional naturopathic energy to a modern functional medicine or conventional diagnostic medicine, with the underlying desire and intention to get to the root cause to activate your own innate healing response. So before I got into integrative medicine, I was in primary care and a hospitalist. So I was very heavy into the conventional insurance based model. And, being a woman, I would say like 90% of my patient panel, about 15,000 women I've seen already. So very heavy on women's health. And actually, that's why I went more into women's health. That's my marketing. My Thrive Life Center is more catered to women's health. So, yeah, that's me.
that's great. Thank you so much. All right. So, in your expertise, what is your background experience with postpartum depression?
Great question. So, a lot, because I've seen a lot of women, mothers, and we used to deliver in the hospital. I used to deliver in the hospital, both in the Philippines and here in the
Mm,
United States when I started practicing here. So, yeah, I mean, it's more common than we think. And I think
mm.
the conversation is now more out there. I feel like it's less stigmatized.
I agree. Yeah.
Yeah.
I mean, for me, that was a huge reason why I wanted to start this podcast because when I was struggling, I used to tell my husband all the time, I don't feel like there's enough, you know, either research or women currently going through it that you have access to, because it's
Mhm.
not like you can just stop a woman at the hospital, like, hey, did you have postpartum depression?
Right.
So it's very, very needed. So I'm so grateful that you do that at Thrive.
Mhm.
That is so
Mhm.
wonderful.
Absolutely. Yeah.
Yeah. So, with your postpartum population, we'll be speaking about that primarily. What kind of drove your interest to start the Thrive Life Center?
Great question. And also, just to add, aside
Hmm.
from like an integrative practitioner, I'm so into the birthing world. I'm also a hypnobirthing coach. So, just to connect that, why I started Thrive Life Center, I became a mom.
Mm,
So when we become mothers, in my own experience, there's something inside of you that awakens or dies, right? Like things that you need to
mhm,
let go of and things that you need to birth yourself. And my realization was, even though with my best intention to practice holistic medicine in the conventional setting, which is like 15 minutes max per patient, right? It's just not really possible. And
mm,
I wanted to be as present for myself, for my daughter, and for my patients
mm,
in the way that we really deserve how to be cared for.
mm,
That we're beyond just an ICD diagnosis. And so I had to untangle myself with the system so I could explore more with my patients who I serve what the root cause is. And I think time is so essential to get to the root cause. So that's kind of the very abbreviated version of how and why I started Thrive. And thankfully, like my first pregnancy and birth was so empowering. It just activated my, I don't know, like just different level of womanhood.
mm,
And one of the tools that I used, I think that really helped me set up for success for postpartum was the hypnobirthing. So then I became a hypnobirthing coach. But to like speak to your audience who might be experiencing some challenges in their postpartum, I unfortunately had kind of a traumatic second birth. And then kind of opened my empathetic heart, like, oh my God, this is what women go through. And so now I have that lived experience of kind of how do you digest everything from the trauma on a physical level, the neurochemistry, the story that you kind of keep ruminating, no, like what could have happened differently. And it's just so
Mhm.
I think aside from early childhood experiences, birth, I think, is the root cause of everything. Like that
Mhm.
is how we can heal the world. If we really set ourselves up for success on how we conceive pregnancy and how we birth, I think we will solve a lot of the problems in the world. Sorry, that was like a long answer. And now I'm pregnant. So I'm in this
Oh!
exploration again. And because I have those like in the, it's funny. I feel like my life magnetizes me exploring the concepts of integrative medicine. I have this like the possibility of what a postpartum bliss, orgasmic birth can look like, and then also the traumatic birth, so now I'm like
Mm.
on my third birthing like pregnancy exploration. And so I'm with you with this, and I'm also a student.
Yeah, we're always learning, right? It's crazy. So you mentioned the hypnobirthing, which, I've mentioned this a couple times on my podcast. I am a physical therapist, so I have a decent medical insight,
Mhm.
but I actually know nothing about hypnobirthing. So tell us a little bit about the background of what that is and why you were drawn to it.
Right, great question. So my intention in having a birthing course, honestly, was to experience birth and pregnancy from a non-medical perspective.
Mm.
And that, it's so funny, right? Because I'm a medical doctor. Here I am delivering babies, providing prenatal care, and doing all these medical stuff. But I wanted to challenge, like, is that all there is to it? I mean, there's just so much dimension to your experience of birthing and postpartum. So I researched like Lamas, Bradley, and all these other things, right? And hypnobirthing attracted me a lot because it's actually very non-medical. It talks a lot about your subconscious and unconscious mind and how arises in
Mm.
your current body, and how fears, narratives, and programming to women shows up in the birthing day and postpartum,
Mm.
so, and I had an experience with my integrative medicine training on hypnosis, and I think it was just so mind-blowing, like how you can use subconscious to really get the outcome that you want. Because we operate, our brain operates, like all of our behaviors, all of us, like who we are, is 90% subconscious. I mean, that's huge, right?
That's a
Like
lot.
10% is conscious and 90% is like all these deep-seated unconscious wiring on how we perceive and behave in the world. So for me it was like, oh, I want to explore this, and I enjoyed it. I loved it. Now I'm a
Hmm.
practitioner.
Right. So with the hypnobirthing, is that something that moms will go through while they're pregnant and then postpartum as well?
Great question. No, it's prepartum, prenatal care. So it's a birthing course to help you
Oh,
prepare for the birth and beyond.
okay. Okay.
Mhm.
So when you're doing the hypnobirthing with the moms prepartum, are you talking about things like the possibility of postpartum depression and other risks that they take when they are pregnant, or what does that entail?
Yeah, we talk about postpartum, like how to check in, um, and also how to pacify really the nervous system. How can we go into that safe place through visualization, through breath work, through movement, through
Mm.
affirmation. So we not only talk about what are the symptoms of postpartum, but how can we deal with it now and have the habits of relaxation and affirmation before it even happens. So you already have the tools how to process your birth, because birth really is in many ways traumatic. Like from a physical standpoint, it's the first time, especially if it's your first birth, it's the first time that you took your body to this extent. And it's like a jump, right? Like it's a
Mhm.
jump for many of us. And hormonally, the first 2 weeks, we're kind of like navigating these ups and downs, like all these hormones is just like calibrating. And so it's such a vulnerable place and time for us.
Yes, I absolutely agree with that. So, from your perspective, it's much more about the preventative things that you're doing when you're pre baby.
Yes, it's very, for me, the key is come into motherhood, come into the birthing scene, knowing what you're worthy of,
Mm,
knowing your capacity, knowing who is invited and who isn't.
I love that.
Most
Mhm.
of the post traumatic, postpartum stories I hear, especially after they go beyond the overwhelm of trauma, it's how much reverence, respect, and autonomy was given to the mothers. Like, worst case scenario, this is the risk, this is the risk, this is the risk, this is the intervention. It's like disrupting a certain divine order of how biology works. No, you're not yet dilated after 2 hours. Let's do this. It's so, so very,
Yeah,
yeah,
almost reactive.
yes,
Mhm.
yes,
Yeah, I can understand that, definitely.
yeah,
Yeah, for myself, I didn't progress at all. I was 41 weeks. My cervix was hard. There was nothing going on. So I totally understand where you're coming from. I think that's a great point that a lot of practitioners don't even discuss.
right.
So when you have those moms, in your hypnobirthing courses that you're instructing and guiding, is there kind of a guideline that you give to them, if they're struggling with a certain amount of, say, quote unquote, like the baby blues? Like if they're saying, I feel X, Y, and Z, is there a certain time when you'll tell them, I want you to call me if it gets this bad or if you're feeling this way?
Right, right. Great question. So, uh, what I hear you asking is, when do you ask for help?
Correct.
And honestly, you ask for help for me. And like I said, I'm beyond medicalizing postpartum. I think postpartum help should be asked and ruminated and planned as you conceive. You set up yourself for success. You have your entourage. It's a ceremony, right? Like it's one of the most important ceremony, like marriage, baptism, or whatever, graduation in our lives. And you
Mhm.
always think of who should be there. So that's from a preventive standpoint, right? And then two, of course, like there's all these like list that we have, like the PHQ-9 score, how's their mood, are they eating, are they sleeping, what are their thoughts, do they have feelings of guilt, can they still see the funny side of things, are they pooping, are they like showering. So all these like physical and emotional scale that we ask, and if there's more change and not in the optimum, then definitely see a medical practitioner, and maybe then you need something pharmacological to balance you off. I'm
Mhm.
not anti pharmacy. I am pro preventive and pro help. So ask help from the beginning, set up your entourage like your marriage, like your wedding ceremony. Like you have to have that entourage, whether that's a postpartum doula, that's your best friend, your mother, your husband, so that you feel super supported and safe, that you don't need to do anything else except be a mom. A lot of women are feeling pressured to still perform in the same capacity that they used to before giving birth.
Mm. Yep.
Versus, like, can we honor the sacredness of this time? Can we, like, recognize that your body, mind, and your sleep has so much, you're already doing so many things, and yet here you are, all these mothers, oh, I have to do the dishes, I have to cook, I have to blah blah blah, and am I breastfeeding well? Am I breastfeeding? Is he getting enough? Like, there's just so many decision fatigue that's happening, versus, like, where can you get that affirmation? Where can you get that you're doing well? Like, we got you. All you
Right.
have to do is be for yourself, take care of yourself, poop, eat, pee, and then tend to that baby.
I agree. Yeah. I think it's so easy to think. I used to actually say that to my mom. People tell you, nap when the baby naps, take a rest. And I would always say, Mom, I cannot. Like, I have too much to do. Like, this house has to be run. And she said, Well, I'm here. So I said, Okay, you can do the laundry and sweep the floor. But
Yeah.
still, it's just sad because I think in today's society, like, there's just so much of this whole era of like mom guilt. And I hate it because I fall prey to it myself. But I just think it's so ridiculous that we think that this is like quote unquote, I'm air quoting over here, like normal. Like,
Mm,
that shouldn't be normal to feel that, like you said, your body's gone through the most trauma. Even if
mm,
you had a normal, healthy vaginal birth, your body still had to prepare for that for 40 or 40 plus weeks, then
right.
to prepare you to push out the child. So you're
Yeah,
dealing with that as well. So I don't think we give ourselves enough grace from the beginning.
right, right. Because we're so indoctrinated or used to the masculine energy of
Mm,
linearity, of, hitting outcomes, meeting deadlines, and checking the box. That dopaminergic, like, check, check, check. Ooh, it's so addicting. And
right.
what is that other hormone that we need to invoke and invite in our lives, especially as women, especially during birthing day and pleasurable life, is oxytocin. And oxytocin is the pleasure hormone. Oxytocin is the same hormone that we achieve when we're in orgasm. And can a woman orgasm when she's thinking of the to do list? So we are in this doing energy, the very masculine energy and dopaminergic, and we're so used to that. And then here we are, we need to birth, and we need to, like, create that cocktail of oxytocin when we haven't exercised enough or rehearsed enough the undoing. The, oh, that is so sensual, and, like, and there's a movement, it's called the orgasmic birth. Perspective is that birthing and postpartum is very sensual. It's part of our sexual life. It is kind of the peak. And I think that's what's happening in postpartum. We feel so violated and lost how to navigate that when we didn't have the orgasmic, pleasurable birth and empowered birth.
Mhm.
So there should be, like, that intimacy, safety, and safety is the key thing. Like, you need to feel safe. And maybe for you, because you were, like, in this deadline, this threat, like, oh, what's gonna happen if I don't labor by 41 weeks, you know?
Yeah.
And there's another side of birthing world where Due date is a guess date. There's
Mhm.
no pressure. So imagine what if we take off that pressure. Like you birth when baby and mom is ready.
Mm.
You do the laundry when baby and mom is ready. How can we unpressure ourselves?
Mm. I love that. Yeah, that's very powerful. So when you're talking to your postpartum moms, do you ever give them like, I hate to say a guideline or a checklist, but almost kind of what you said, it should be prioritize your health and the baby's health first, and then everything else is after. That makes
Mhm.
sense to me. Absolutely. So I
Mhm.
just wonder, is there something that you will tell your moms, if you do one thing today, that's great. Or if you do one thing a week, or for you, is it more about them making sure that they are good mentally?
I think it's all of it. Number one, safety first, right? That's where the medical community comes in. Are you safe? Are you having thoughts of harm? And then we
Mm,
elevate the conversation to, okay, what is the trauma? What is it that you're trying to go through to get to the other side? Like, what is the overwhelm? What is the guilt, the shame? Where is that coming from? Where in your body are you feeling it?
mm,
And then we elevate again the question, what feels better for you? What is the
mhm,
dream?
mhm,
And how can you, even without the external validation, like for example, oh, I would just feel better if my dishes were done, or I would just feel happier if I had my sister here. Like, let's say it's just not going to be done. How can you then feel the feeling of if your sister was here or if the dishes were done? What is that feeling? Can you embody it without it? And then
yeah,
from a physical standpoint, like, okay, then how can we be precise about it? Is there a unmet need? Is it water? Is it sleep? Is it food? Or is it just showering?
right, yeah,
You know?
yeah,
So
yeah,
then look at the unmet needs. And then we keep going higher and higher until you're actually enjoying the present moment. And this
mm,
is where I think the conversations should also go, because my issue sometimes with, when we start like postpartum depression, I think we need to have a conversation. It is happening. It is like, it feels hard. It's so
mm,
challenging. And I
yeah,
wish there's more people who I can talk to how hard it is. And I get that. I really get that because I went through it. But what I also want to happen is, can we expand the conversation? How can I digest chew on the hardness while I'm still focused on what is it that feels like postpartum bliss without
mm,
minimizing or skipping a step of the trauma or the unmet needs that you need to fulfill or listen to, you know?
yeah,
I don't
that's
know if that
powerful.
made sense. Yeah.
Yeah, absolutely makes sense because for me, my husband obviously knows we've been together almost, 13 years now, but I'm like the what if queen. So
Mm.
that drives him crazy because, men are like, for me, my husband is black or white. He either is or is not. If it's not
Yes.
happening, it's a
I
no.
love it. Yeah.
Yes. But for me, I'm not going to lie. I had my daughter in June of 2020. So you're talking the height of COVID, no
Mhm.
hospital visitors.
Mhm.
No one in my family came to meet her for at least a month and a half. And so there was a lot of what if. Like looking back when I had postpartum, I would sit in the hospital and tell the therapist there, like, what if it wasn't COVID? Like, would I have been in a better mental place? Like, what if my sister was here? Kind of like you mentioned a sister. What if my mother-in-law came sooner? All of these what if, what if, what if. And I think sometimes, at least for me, it sends you in like a downward ruminating spiral of just awfulness. So, for your client, if you have that mom who is focused on the what if or things that are situations that obviously we can't control. What is some advice that you would then give her?
Yes, I love this question, and thank you for sharing that, because that is so so common in who I see, and me personally, right? Like what could have happened if this was a different scenario. So um and I got this technique from a dear sister of mine too, like in the women's health world, where we view things. How can we view things? No, one is hindsight. So that's what you were doing. You're reverse engineering. What if, like, looking at the past, right?
Mhm.
And then insight is what is currently happening from the backstory. And
Mm,
then I think this is where we sometimes, for what we forget is the foresight, like what I was telling you. What is the north? Google Maps can't tell you how to get there if you don't give it directives. So you gotta be clear also on your foresight. But in trauma work, how do traumatized or depressed or anxious people, anybody who's dealing with emotional wellness challenges, is those who can go beyond survivorship and really thrive and could not even align with the depression or the abuse or the anxiety anymore, are those who can look back and change the narrative around it. Like they can actually revisit the past, and instead of what if, you can say, oh, you know what, that past, they could see almost like the blessing of it.
mm,
They have a different hindsight after
mm,
they've processed it. The hindsight is like, for you, I imagine, and for me, I was also like a pandemic baby. My second, he was born September 2020. So for me, it was like, initially I had that like, what if my mom was here, or blah blah blah. And then now I see it as, I was given a gift of silence. I was a given a gift of, there was no imposed pressure or projected beliefs or any projections from how I should have mothered, because I was not witnessed. I got
mm.
to do what I want to do
Yep.
without blame and judgment from other people, because that's, you do that enough yourself, right?
Right.
So it's, that's the first thing I would encourage my mothers to do. How can you view things, hindsight, insight, foresight, and then how can you change the narrative into an empowering one? Like, I'm not discrediting it was hard. I'm not discrediting that, like it feels like you were a victim of something. But how can
Mhm.
you be a victor from that story? What is it
Mm,
that you can gain from it?
yeah. Yeah, I love that. I've met a couple really cool moms who have gone through postpartum depression as well. And I think something that we all agree on is that, when you overcome something like that, especially for myself and the one other mom, I mean, when I was sitting in that hospital, I really thought that was it. Like when my husband would come visit me, I used to tell him, I guess this is just our life. I'm not going to be a productive physical therapist anymore. I'm just going to have to be at home doing I don't know what. I was just so lost for
Mm,
me. And, as I am a very strong Christian, we're very involved in our church. And so for me, I also carry that guilt of like, how am I a Christian right now if I'm not putting my faith in the Lord? Like, how do I not realize all the other things that He's brought me through? So I think that also was another little part of the guilt that I put on myself. But
mhm,
I love that you said it's about finding how to be a victor, because I think you think about any other type of mental health disease, like
mhm,
just depression in itself. It's not having the hindsight of what you could have, should have been doing. It's having the foresight of saying, I want to be doing this.
mhm, mhm.
So I love that you shared that. Thank you.
And
So,
just to add to I want to be doing this, and that desire and that like impulse from mothers is so present in many of the seasons. And I go through it, like the moment I found out, oh my gosh, I'm pregnant, do I need to close my patient panel? Like, how can I expand my mission and my impact while I'm now pregnant and I'm going through my first trimester challenges? There's all that push and pull in the season of motherhood. And so
Mhm.
what I want to bridge to is that everything has a perfect timing. That is the feminine energy. We are cyclical beings. We are not, okay, we are mostly feminine energy as a female biology
Mhm.
compared to a male biology, which is very masculine energy, and that is the sunrise and the sunset. That is their energetic reflection in nature. Our energetic reflection in nature is Mother Earth, and she has her seasons. There is winter. So winter is usually also tied to our menstrual cycles. So winter is menstruation. And what do we see in winter? Is there life and activity going outside? There is contraction, there is stillness, there is silence. So copy paste that on postpartum because you're bleeding, you just had the baby, and copy paste that on your menstrual cycle, like you're bleeding. How can you be in your winter season where there is stillness, there is silence, there is darkness? How can you rest and reflect? So that is the call of winter. Then after winter, we go through spring. That is the follicular phase where our ovaries are starting to produce the estrogen and progesterone, so that the map goes like this. There is a bit of flower outside in nature, right? So this is where we're also kind of going out. Usually in postpartum, this is around month 9 to 18, where we're starting to have that cycles again, no, where our follicular phase is going up. And the question in spring is, what do you need to initiate? So spring season in motherhood is also like around school age, like 3 to 6, 7 year old. That is
Mm.
when the time like, oh, I'm done with the infant stage. I can actually start doing things again. You know,
Yeah.
it's not heavy like breastfeeding and putting baby to sleep. And then next is summer. Summer peak season in our womanhood is like in our mid 30s to 50s. And it's also ovulation. And summer is like a lot of activity. So in our kids' life, that is when they're around teenagers. So we are like, oh, I can do my thing. I can scale whatever I'm doing. And you're ovulating. So you are so magnetic. What do you need to attract, and what do you need, kind of like, what needs to get fertilized? Who do you need to collaborate? So every time you're
Mm.
ovulating. And then next is fall season. And this is where most women lose it or don't get it. Fall season is luteal and early postpartum. Luteal stage is after you conceive or after you ovulate. So what happens in the hormones? It starts to drop,
Mhm.
right?
Right.
Postpartum,
Right.
immediately it starts to drop. And
Mhm.
we were so intoxicated from our ovulation. We're like, oh, there was so many activity. I got so many things done. And we don't know how to slow down and celebrate fall season. What is fall season? It's harvest, Oktoberfest, apple picking. How can we celebrate the bounty instead of like still of pressure going back to summer? Like, what can I do more? Fall season is like postpartum, early postpartum. Like, how can you celebrate what you just gave birth?
I think that's great. Thank you for that analogy. That was so insightful. I had no idea that there was, difference in obviously the way that men and women process in seasons like that and the way that our bodies are in tune to that and the way that you broke that down. That makes so much sense.
Mm-hmm.
It's sad
So
that people don't talk about that more.
right, right. So we are kind of in the spring, summer season in our womanhood. And we
Mhm.
want to prepare for winter. We want to prepare for, and this is like going beyond postpartum, right? Like menopause. How can you like feel amazing during menopause? This is the next season that we have. Anyway, so we can stop there. I know that that's kind of beyond
No,
what
you're
we
fine.
intend.
You're fine. I love it. I love it. I appreciate the insight. Okay, so talking about our postpartum moms, when you're seeing them in your practice, I know in therapy we use a lot of outcome measures. So it gives us something to reference and track someone's progress or if someone's having, barriers to progress. So I know in mental health we use that PHQ-9. So I just wonder, do you use that to track your patients and see how they're improving with their mental health?
Yes and no. Like I do it sometimes just to have an objective scale. But for the most part, I go deeper than the scale. I mean, just with this conversation, I go deeper, much deeper than that. And honestly, the feedback that I get from institutionalized or those who really needed inpatient care is that, and this is my kind of response and how I'm listening to the feedback, is that those questions just feel so robotic.
Mm, I agree.
It feels
Absolutely.
so sterile. So I use it as a framework, but I make it a little bit more human. So the simple answer is yes, I use it, but not in the way that it's very like checkbox.
Correct.
Yeah.
Correct. And I think as someone who had filled that out ad nauseum, I think so many times it's so hard to figure it out. So for those who don't know what it is, do you want to just give like a quick little rundown
Sure,
of?
yeah, I have it. Like, so it's examples of what you can ask is if you felt happy, is it all the time, most of the time, not very often. You're able to see the funny side. I look forward to enjoyment of things as much as I ever did, less than I used to, definitely less than hardly at all. I blame myself unnecessarily when things went wrong. Yes, sometime, often, never. I've been anxious or worried for no good reason. I feel scared, panicky. Things are getting to me. I've been so happy, unhappy, and I've been crying, and thoughts of harming myself occurred to me. So that's, I think, the main question that I always ask, because safety first, right?
Mhm.
Mm-hmm.
Absolutely. And I love that, we talked a little pre-recording about that, the fact that safety has to be priority. And I think for me, once I started having those overbearing thoughts of harming myself, I would say to my husband, like, this is not me. Like, this is where we have to draw the line. We'd been searching for help way prior to that. But I think at that point, it was like, I cannot keep going like this. And we both knew that. It was just more or less kind of, we sat in the one psychiatrist's office and he kind of mentioned that. And I just, kicking and screaming, but I went. And I think looking back to becoming a victor, like how you mentioned, um, I think me being in the hospital was absolutely necessary. I mean, it was terrifying and a bunch of other adjectives, but it was necessary because it got me to where I am today.
Yes, of course. And that's why like conventional medicine is still here, because it's
Mhm.
needed, and it's a good safety measure and a good like first line to get
Mhm.
us beyond like, when it's just overwhelming.
Sure. Sure. So let me ask you this before we wrap up. What are one or two resources or maybe important topics that you tell your prepartum moms to either start reading about or maybe researching or things that you're teaching them one on?
Hmm. There's so much, right? I would say like I love to use the framework of mind, body, spirit. From a mind perspective, who and what can you learn, read that will lessen the fear. So one would be hypnobirthing. There's other type of courses. Body is who can physically help your environment and your body so that you're nourished, whether that's planning meals, having friends help you out with logistical things. And spirit, like if you're faith based, maybe reach out to your church. How can your soul feel less of the blame, the guilt? These are the common emotions that we go through. How can you stay in trust and surrender from a spirit perspective? And maybe even start having that conversation as you're pregnant. I specifically hired a postpartum doula. I hired a lactation consultant. I hired my dream team. I even hired a therapist, even though I didn't have postpartum the first. I just started the conversation going. Whatever that looks like to you, invest in yourself before it happens so that the
Mm,
trajectory is success.
absolutely. I think
Mm-mm.
that's key. I think that's the majority of the battle is that, personally for me, prior to having the baby, I was very plugged in and involved in our church, but only as much as I could be because of COVID. So
Mm-hmm.
at that time, church was online. So that took out all of the face to face. So that did change a lot. But I think I definitely could have done more as far as either a doula,
Mm-hmm.
which we were in the process of hiring one. However, at the time, they couldn't come to the hospital with you. So
Right.
she would have had to be our doula on FaceTime. And maybe looking back, that was the extra little encouragement push that I needed that I didn't have. But like you said, I can't antagonize myself about hindsight. But I
Mm-hmm.
think with the knowledge that I have and also with, all the wonderful wisdom you brought today is that when I'm ready to have number two, is that those are things that I will definitely have in place the second time around.
Mm-hmm. Yes, absolutely. And maybe how can we all like expand the vision of where to give birth? So I'm
Mm,
challenging the hospital system in many ways because study can still validate that it can be still safe to have a home or birthing center birth. So
I
just
love
explore that. I'm not prescribing anything. It's really up to your values and your safety level, but there's many worlds out there on how you can navigate birth and postpartum.
I love that. And thank you for sharing that. So, is there any, I don't love the word advice, but I do because it's so necessary. But from your experience, both as a physician and as a mom, for someone going through their first birth, and, obviously COVID, it still exists in these times, but it's not nearly what it was, when we had our children. So, what is some type of advice that you would give them? Would that be to hire that dream team that you kind of mentioned?
I would say I would start with the foresight. How
Mm,
can you anticipate positively and invite the possibility of a very joyous and safe and peaceful postpartum? And that
mm,
looks different for everybody. But
right.
I would lean on the foresight. Like how can you think about it? And even like see it's possible. Yeah. Yeah.
I know because I think mindset is key. There's
Yeah.
so many mindset coaches out there these days, and I think that if you're constantly worrying for me about the what ifs or things that are out of your control, I think you're putting all of that into your mind when you really
Mhm.
need to have that mental shift to
Right.
prepare your body for what's coming.
Right. Right. Because the fear and the what ifs and the worries and the worst case scenario will still come up as you ruminate about the best because that's just our wiring. Like our
Right.
brain is designed to protect ourselves. So can we go beyond the survival brain because it's there. It's not going to go away. It's there to
Right.
support you. So let's just elevate the vision.
Yeah.
Mhm. Yeah.
Yeah, you're right. You're right. Absolutely. Okay, final question, Dr. Petralba. What is one word that you would describe your profession as?
My profession. I would say I'm a healing specialist.
Mm.
Yeah.
Go ahead, expand, expand. I love that.
So healing for me is making the connection. To heal is to connect mind, body, spirit. To heal is to embrace all of you,
Mm,
the past, the present, and the future. There is no neglect or rejection, meaning even being depressed is welcome because that is who parts of you. And
mhm,
when we are not afraid to embrace being ugly and depressed, we can also be more less afraid and courageous to be so beautiful and so joyful. So
yeah.
we heal that. We welcome the spectrum of who we are. That is healing to me. And we trust that we can be both.
I love that. That's powerful. That's very powerful. Just from talking to you, I think I can just feel in your spirit that you have such a warm personality. It's captivating because I want to just keep talking and talking. So I think what you're doing at the Thrive Wellness Center is amazing. I'm very,
Thank
very happy
you.
for you.
Thank you. I am happy. It's a dream job. Like I feel like I'm this is me like stepping into like my dream. This is the foresight and I'm living it. And
Mm,
I think every woman deserves to feel that way postpartum and
mhm.
beyond. Mhm.
Oh, I love that. Well, thank you so much for being a guest today. You were hands down amazing, and I just know our listeners are going to love it.
Love it. Thank you. I
And then,
enjoyed.
while I have
Mhm.
you on, Dr. Petrova, would
Yeah.
you like to share your website so the listeners can go and check it out?
Absolutely. So there's two ways to work with me. If you're in Arizona, you can see me as your provider. So follow me at thrivelifecenter.com. But if you're anywhere in the world listening to this, I coach women globally so that they can go beyond the burnout and thrive in all areas of their life. So that website is thrivewithdrpatricia.com. And I have a free Facebook group where I host free healing retreats. It's called The Thriving Woman.
Wonderful. I can't wait to join. That would be so nice to meet you in person.
Yes, yes, yes.
Well, thank you so much for your time. I'm so glad that you were here.
Me too.
All right, guys, we'll catch you next week on our next episode. Thanks for being here.